Hey guys, how are you guys doing? There were some people on the channel who were asking, can you make a quick video of how to make a good summary? So that's one of the hardest things, right? Making a good summary for your case is because most of the details are important. It's obvious, like your history, your exam, everything's important. But it's a matter of finding what is most relevant for this patient and the management. That those are the things that would be more important, that should be included in the summary. And it's entirely dependent on your case. So two summaries would never look the same. They would include totally different things. So that's the way it is, right? So for an example, let's say you're talking about a patient who's coming with shortness of breath, who's known to have COPD. So in this case, whether his exposure histories, his whether he's smoking currently or not, those things will be very very important, right? And if it's a case about a decompensation of a liver disease who's coming with ascites, then smoking history is important, but it won't be that relevant to the current presentation. So it might not be included in the summary. So you get what I'm saying? Depending on your case, the things that will be included in the summary would be different. For an example, again, if somebody's coming with abdominal pain and diarrhea, their travel history, did they go on a recent backpacking trip, did they go on camping, did they eat some dodgy food? So these kind of things would be very important in that case. But again, what they eat or drink would be less. It won't be that important in a case of you would say shortness of breath or something like that. They're important, but they're not relevant for the current. They're not the most relevant things. So how do you know what is relevant and what is not relevant? That will come to you, my friend. That will come to you with experience. You will know, okay, this is relevant and this is not. And it's just that with as time goes on, you'll be more experienced to identify what's relevant and what's not. But for now, just keep in mind, you include in your summary, you include some of the patient demographics, you describe the most important details of the presenting complaint, and then use the most things to support your main diagnosis, and the important negatives to exclude the important other differential diagnoses, any quick complications, the overall status of the patient, so things like that. So if I say, okay, about a chest pain, there's this 65-year-old gentleman who's a truck driver who presented with chest pain. Started 48 hours ago. Pain's completely settled now. Symptoms are mostly keeping up with ischemic type chest pain, or you could say something like that. It's a central crushing chest pain that is ready into the neck with associated autonomic symptoms with sweating and diaphoresis. So you could say that, but I would personally say symptoms are keeping up with ischemic type chest pain, and he does have diabetes, he does have hypertension and dyslipidemia as well. Also, analyzing the symptoms, there were nothing to suggest an infection, or you could say there was no fever and cough, and there was nothing pointing towards a pulmonary embolism as well. Or you could say there was no leg swelling, no leg pain, no history of clots, and no recent immobilization like long distance flights or recent surgeries. It's a matter of, like, you could go either way. I personally prefer to say the diagnosis I thought about, and there was nothing to suggest that. And if body somebody's skin, you could you're telling there's nothing to suggest infective symptoms. What is it? Then I would say there was no fever, there was no cough, there was no coryzal symptoms, stuff like that. I just like to keep it very simple and short. But it's either way, it's not right or wrong. So do what just find your flavor, right? So 65-year-old gentleman coming with chest pain, 48 hours ago, pain settled, symptoms are keeping up with ischemic type chest pain, risk factors were diabetes and hypertension and dyslipidemia. Symptoms were not suggestive of infective cause, not pointing towards a embolism either. And then you would drop into the examination. He's comfortable, pain settled, vitals are in the normal range, cardiovascular system did not, I couldn't find any murmurs, or I couldn't see any signs of heart failure. And yeah, and then you could say, yeah, when he's in the hospital, there was ECGs done, there were bloods done, this for this, and this for the current management as such. So if you're just stopping at history and exam, that would how it would look like. So that's a very simple case. So just try to think of the different, try to think of the different presentations: chest pain, shortness of breath, abdominal pain, leg swelling, and think of what is your main diagnosis. Tell things to support that, and then tell things to exclude the other important differentials and the overall status of the patient. Are there any complications as such, and the important risk factors? So if you can, if you can tell a bit of that in everything, that would be it, right? So yeah, and other parts of the history, of course, allergies, family history, social history, all of these things are important if it is relevant. So let's say if you're talking about a patient with cellulitis and then there is a penicillin allergy, that penicillin allergy could be mentioned in the summary. Of course, it should be mentioned. But if you're talking about something about a chest pain, the supportive of acute coronary syndrome, then a penicillin allergy might not be that significant. You get what I'm saying? So even allergy history, everything like that is important. So if your case is about something like rheumatoid arthritis, a first presentation of that, then of course the family history of autoimmune diseases and as such would be important. But so each case would have different things that are most relevant. Try to find them and try to include them in the summary, and with time you would be better at doing that.